For 7 years, Joanna Selig was the trauma ward's best-kept secret, not because anyone tried to protect her, because no one thought she was worth noticing. She took the overnight shifts nobody wanted. She mopped the bays after the worst cases. She restocked the crash carts at St. Brendan's Regional Medical Center in Thunder Bay, Ontario, at 3 a.m. without being asked, and she never once put her name on the whiteboard when a difficult patient stabilized on her watch. The other nurses called her the ghost. They didn't mean it kindly. Her direct supervisor was a charge nurse named Paulette Dumont, 31 years old, fresh off a leadership certificate from Lakehead University, and absolutely certain that the certificate made her the most qualified person in the room at all times. Dumont had the kind of professional confidence that fills corridors. She wore her lanyard like armor. She sent emails with the word "per my previous message," and never once noticed that the person cleaning up after her mistakes was the same quiet woman who'd been assigned the supply closet as her unofficial office. Selig was 34. She had dark circles that lived beneath her eyes regardless of how much sleep she got, which wasn't much. She wore her hair pulled back in a utilitarian knot that she hadn't updated since she left the Canadian Forces 5 years ago. Her scrubs were standard issue blue, slightly too large, the kind that swallowed the body rather than fit it. If you happened to catch her forearms when she rolled up her sleeves, which she rarely did, you'd notice a network of pale, precise scars that didn't come from any kitchen accident, but nobody at St. Brendan's had ever looked closely enough to ask. The trauma ward at St. Brendan's wasn't a prestigious posting. It was the kind of place where paramedics came in looking 10 years older than when they'd started their shifts, where the coffee machine in the break room had been broken since February and nobody had filed the work order, and where the head of emergency medicine, Dr. Raymond Gould, ran his department like a feudal estate. Gould was 53, silver-templed, and had the handshake of a man who wanted you to know he'd published in the Canadian Medical Association Journal. Twice, he said, "In my professional opinion," the way other people said, "good morning." He had once, in front of the entire nursing staff, told Selig that her input on a patient's medication interaction wasn't something he'd solicited. She had simply nodded and gone back to hanging IV bags. 3 weeks later, the patient Gould had dismissed her concerns about was transferred to the ICU after a preventable cardiac event. Selig had already quietly flagged the chart to the attending pharmacist the morning it happened and suggested an alternative. The pharmacist had relayed it to Gould. Gould had overridden it. When the patient deteriorated, Gould wrote the incident up as an unexpected complication. Selig's name appeared nowhere in the report. She kept a copy of the original chart notation in a folder at home, filed alphabetically, inside a locked drawer of a fireproof cabinet. She'd learned that habit in the forces. Nobody at St. Brendan's knew about the forces. That was deliberate. When she'd applied for the nursing position 5 years ago, she had listed her civilian credentials, her registered nursing designation, her emergency triage certification, and her graduate diploma in critical care. What she had not listed, because it was not required, and because she had no interest in explaining it, was that she had spent 6 years prior to that as a combat medic with the Royal Canadians Medical Service, attached to a joint task force deployed twice to Afghanistan and once to a forward operating base in Mali. She had not listed the Meritorious Service Medal she'd been awarded after a firefight in Kandahar province, in which she had kept 4 soldiers alive in a drainage ditch with no proper surgical equipment, and a tourniquet she'd improvised from a rifle sling. She had not listed any of it, because she had come home from her last deployment with a medical release and a very strong preference for anonymity. The woman who came back from Mali wasn't the same woman who'd left. Something had gone quiet in her, deliberately and permanently, and she had decided to keep it that way. So she emptied the Sharps containers. She took the combative patients that Dumont strategically assigned to her because dealing with them required patience rather than flair, and patience was the one thing Selig had in surplus. She worked Christmas and New Year's and the long weekend in August when everyone else had booked off, and she never once complained about any of it in the break room or anywhere else. She just did the work. The night that changed everything began the way most terrible nights at St. Brendan's began, with a phone call nobody wanted to answer. It was 1:47 a.m. on a Thursday in January. The ward was running a skeleton crew. Dumont had taken an administrative break in the staff lounge. Her terminology for sleeping on the break room couch with a clipboard balanced on her chest to maintain plausible deniability. The only physician on the floor was Dr. Nate Leclerc, a second-year emergency resident from Sudbury, who was brilliant and terrified in roughly equal measure, and who had, twice in the past hour, consulted Selig about patient assessments while pretending he was just thinking out loud in her direction. The trauma line rang at 1:47. Selig picked it up before the second ring. Trauma, Selig. The voice on the other end belonged to the charge paramedic, and it was doing the specific clipped thing voices do when the person speaking is managing fear by compressing it into information. Coming in hot. Single vehicle rollover on Highway 11, northbound near Shunaya. Patient is 26, female, Canadian Army on leave. Ejected from the vehicle. We've got an open femur fracture, suspected internal bleeding, GCS of 9 and dropping. She's in hemorrhagic shock. BP is 74/40, and we cannot get it stable. ETA 4 minutes. Massive transfusion protocol, and I mean it. Copy, Selig said. She hung up and moved. She hit the trauma alarm. The fluorescent overheads flooded the bay, with light so sharp it felt like an accusation. She went to the supply cabinet, not walking, not running, moving at the particular velocity that came from 6 years of having to be fast without being visibly panicked, because visibly panicked was contagious, and contagious got people killed. Leclerc appeared in the doorway, blinking. What is it? MVC, hemorrhagic shock, suspected abdominal bleed, open femur fracture, 26-year-old female, active duty military. She's in trouble. Selig was already pulling the rapid infuser from its hook. I need 2 large bore IVs primed. I need the massive transfusion pack from blood bank on the phone right now, and I need you to page Gould. Leclerc blinked again. Gould is going to be furious. It's almost 2 in the morning. She's 26 years old and she's bleeding out on Highway 11. Selig said, not looking up. Page him. Leclerc paged him. The paramedics came through the bay doors at 1:52, and it was immediately apparent that things were worse than the phone call had suggested. The patient, her dog tags read Tremblay, S. CF, had a blood pressure that the monitor couldn't hold on to. Her femur fracture was severe enough that Selig could see the deformity through the trauma pants, and her abdomen was rigid in a way that meant the bleeding wasn't slowing down on its own. Selig was at the gurney before it stopped moving. Tremblay, she said, leaning into the patient's line of vision. Can you hear me? I'm Selig. I'm a nurse. I've got you. The young woman's eyes focused for a fraction of a second. Her lips moved. Selig leaned closer. "Don't let me go," Tremblay whispered. "Not a chance," Selig said. And she meant it, with a specificity that had nothing to do with hospital protocol. What happened in the next 11 minutes was later described differently by everyone who witnessed it, depending on what they'd been paying attention to. Leclerc, who would recount it with his hands shaking slightly, described it as watching someone shift registers entirely, as if Selig had simply stepped out of one version of herself and into another without pausing. The paramedics, who had seen a lot, stood to the side and let her work because it was clear within 30 seconds that she was the most competent person in the room. One of them would later tell a colleague that it reminded him of the footage he'd seen of military medics in field situations. That particular quality of movement that was entirely without waste. Selig got 2 large-bore lines in within 90 seconds. She called the blood bank herself, gave the order in the precise language of someone who had initiated MTPs in environments where the blood bank was a cooler strapped to the side of a helicopter and had the first units running before Leclerc had finished washing his hands. When Tremblay's blood pressure crashed below 60, Selig didn't reach for the crash cart checklist. She called it and had already begun drawing the medications before the laminated card was off the hook. "She needs an X-lap," Selig said to Leclerc, who was finally catching up. "Splenic laceration, possibly hepatic. The rigidity is too diffuse for it to be just one source." "I can't authorize that," Leclerc said, which was technically correct, and he said it in the pained way of someone who knew that the technically correct answer was inadequate to the situation. "I know. That's why you paged Gould." "Where is he?" A shout from the hallway answered that. Dr. Raymond Gould arrived at 2:03 a.m. in street clothes and the expression of a man who had been interrupted from sleep and wanted everyone present to understand the significance of this sacrifice. He took in the scene, which by then was controlled in the particular organized Chios way of a trauma bay being managed competently, and he turned to Leclerc. "What have we got, Louis?" "Leclerc." He corrected himself impatiently. "MVC, open femur, hemorrhagic shock, suspected abdominal injury," Leclerc said. "She needs emergency surgery." Gould moved to the bed, glanced at the monitors, looked at the 2 IV lines already running, the blood units already dripping, the vitals that had been pulled back from the edge by about 3 millimeters of margin. He looked at this and said, "Good call getting me in. I'll take over from here. Leclerc, you can step back." He did not look at Selig. He gave several orders, some of which were the same as what Selig had already done, some of which were slower than what she would have chosen, and one of which, a medication dose, made her glance at the order sheet with a stillness that Leclerc, who was watching her, clocked immediately as concern. She didn't say anything. She adjusted the dose quietly when she hung the bag, charted the actual amount administered, and kept her mouth shut. She had learned, at considerable personal cost, which battles were worth having at 2 a.m. in a trauma bay, and which ones were better documented and addressed in the morning through the formal channels she had spent 5 years learning to navigate. Tremblay went to the OR at 2:31. She was alive, barely but alive. Gould, on his way out, said to Leclerc, "Solid teamwork, doctor. You handled the initial presentation well." He nodded in the general direction of the nursing staff, which included Selig but was not directed at her, and left. Dumont, who had appeared from the break room sometime around 2:15 when it became apparent that something significant was happening, made sure she was visible and clipboard adjacent for Gould's departure. Selig stripped her gloves, disposed of them, and went to restock the supplies she'd used. For the next 6 days, Tremblay was the talk of St. Brendan's. She was young. She was military. She had apparently been returning from a leave visit to her family in Nipigon when the ice on Highway 11 had done what ice on Highway 11 does in January. The hospital administration, which had a complicated and ongoing relationship with the Canadian Forces base at Shiloh, whose soldiers periodically passed through Thunder Bay, became very interested in her case from a public relations standpoint. The communications director sent an email about storytelling opportunities. The hospital director, a man named Howard Plante, began making pointed visits to the ward. It was during one of these visits, on Tremblay's 4th day in the hospital, that Plant encountered Selig mopping a spill near the supply room and looked through her in the particular way that hospital administrators look through nurses who are doing physical tasks, and said to Dumont, who was walking beside him, "The Army is sending some people to see the young corporal. Make sure the ward looks sharp. I want our best faces forward." "Of course," Dumont said, making a note on her clipboard. She assigned Selig to linen inventory in the West Wing for the afternoon of the visit. The delegation from Canadian Forces Base Shiloh arrived on a Tuesday at 1300 hours, and they did not look like what Howard Plant had been expecting. He had been expecting, perhaps, a public affairs officer and a junior officer with a certificate of appreciation and a camera-ready handshake. What came through the doors of St. Brendan's trauma ward was a master warrant officer named Fournier, accompanied by 2 officers whose rank insignia Plante could not immediately identify, and a detail of soldiers in service dress who moved through the corridor in a way that made the entire nursing staff go quiet without knowing quite why. Plant stepped forward with his best camera-ready expression. "Master Warrant Officer, welcome to St. Brendan's. I'm Howard Plant, the hospital director. We're so pleased the forces could." Fournier wasn't looking at him. He was a man in his mid-50s with the kind of face that had been outdoors in difficult conditions for a long time, and at this particular moment it had gone completely still in the way that faces go still when they're processing something unexpected. His eyes were moving across the ward with the systematic efficiency of someone who was used to scanning environments, and they had stopped. They had stopped on the far end of the corridor, where a woman in blue scrubs was pushing a linen cart out of the West Wing supply room, consulting a clipboard and paying absolutely no attention to the delegation that had just arrived. Fournier said something under his breath. One of the officers beside him leaned in. Fournier said it again, louder, and this time it was audible. "I'll be damned." He walked past Howard Plant's extended hand. He walked past Dumont, who had positioned herself strategically near the nursing station. He walked the full length of the corridor, with the 2 officers and the detail behind him, and the sound of their boots on the linoleum was the only sound in the ward by the time he reached the supply room doorway. Selig looked up from her clipboard. For a moment, she didn't move. Her eyes went to Fournier's face, and something happened in her expression that was not quite recognition and not quite fear, and was actually both of those things simultaneously. The way it is when you encounter something from your previous life in a context where you had been quite certain your previous life would not find you. "Selig," Fournier said. She put the clipboard down slowly. "Warrant," she said. Master Warrant Officer Fournier drew himself up. He came to attention with the particular precision of someone who has done it 10,000 times, and he brought his right hand to his forehead in a salute that was entirely correct and entirely unmistakable. Behind him, both officers and the entire detail came to attention and did the same. In the sudden and total silence of the trauma ward at St. Brendan's Regional Medical Center in Thunder Bay, Ontario, a master warrant officer and a full military detail rendered honors to a woman holding a linen inventory clipboard and wearing faded blue scrubs. "Master Corporal Selig," Fournier said, and his voice had the particular roughness of someone fighting to keep it level. "We have been looking for you for 4 years." Howard Plant, standing 30 feet away, opened his mouth and closed it again. Dumont had gone the color of the wall behind her. Leclerc, who happened to be at the nursing station reviewing a chart, had stopped reviewing the chart. Selig didn't return the salute. She was in civilian clothes, and she knew the protocol. She gave a single, precise nod instead, the kind of nod that conveyed everything the salute would have without requiring the gesture. "Stand easy," she said quietly. The detail came down in unison. Fournier exhaled. It was a long exhale that had several years of something compressed into it. "I read the paramedic report on Corporal Tremblay's admission," he said. "The interventions, the sequencing, the MTP call. Nobody at this hospital could have done what was done in that bay in 11 minutes without field experience." He paused. "I knew it was you." "How is Tremblay?" Selig asked, which was characteristically the first thing she asked. "She's going to make a full recovery. The surgical team says whoever stabilized her in the bay gave her enough margin to survive the OR." He looked at her with something that was not quite professional and not quite personal, and was entirely sincere. "You saved her life, Selig." "I did my job," she said. It was at this point that Dr. Raymond Gould, who had been paged to the ward for reasons that hadn't been fully explained to him, came through the bay doors and took in the scene with the expression of a man who was not accustomed to arriving late to things in his own department. He looked at the military detail. He looked at Fournier. He looked at Selig, standing in the middle of it. And something in the configuration of the scene did not compute with his understanding of who Selig was and what she was for. "What is going on here?" Gould said, in the tone he used when he wanted to reassert the natural order of things. He directed this question at Plant, which was a mistake, because Plante was still trying to figure out what the natural order of things was. "This woman," Fournier said, before anyone else could answer, "is the reason Corporal Tremblay is alive, and apparently the reason she's alive is that she's been working in your trauma ward for 5 years without anyone here knowing what they had." Gould squared his shoulders. "Master Warrant Officer, with all respect, this is a civilian medical facility. Nurse Selig is a registered nurse, not a physician. The stabilization of Corporal Tremblay was a team effort led by our emergency medicine resident and supervised by myself." He gestured toward Leclerc, who went slightly pale. "Whatever Selig's background is, the clinical decisions here are made by physicians." Fournier turned to look at Leclerc. Leclerc stood very still. He was thinking about what Selig had told him at approximately 2:05 a.m. 6 days ago to do with the rapid infuser. He was thinking about the medication dose she had quietly corrected without saying anything. He was thinking about the fact that when Tremblay's pressure had crashed below 60, Selig had looked at the number with the recognition of someone who had seen it before and had known exactly what came next, while he had been genuinely uncertain. "Dr. Leclerc," Gould said in the tone of a prompt, "perhaps you can speak to your role in the trauma bay that night." Leclerc looked at Selig. She gave him nothing, no nod, no signal, no permission or redirection. She just looked at him evenly, in the way of someone who was not going to make his decision for him. "I was there," Leclerc said. "I was present for the entirety of the intervention." A pause. "But I need to be accurate. The MTP call was Selig's. The IV access was Selig's. The clinical sequencing, the decision about what came next, and in what order, that was Selig. She called the abdominal bleed, and she was right. When the pressure dropped below 60, another pause. I was not immediately certain what to do. She was." He swallowed. "I didn't do nothing. But I didn't save her. Selig did." The ward was completely silent. Gould's face went through several colors in rapid succession. Nurse Selig performed clinical assessments and interventions that were outside her scope of practice, he said, and his voice had acquired an edge that people who worked for him recognized as the precursor to consequences. "There are protocols, there are liability considerations. What you're describing, Leclerc, what I'm describing is the reason that soldier is alive," Leclerc said. He said it quietly, and he said it once, and he didn't walk it back. Gould turned to Selig. "You had no authorization to make those calls. You could have killed that patient. You exposed this hospital to enormous liability. I am going to recommend to Director Plante that your employment here be terminated immediately, pending a review of your nursing registration." It was the most words Gould had ever directed at Selig at one time. She looked at him for a moment without answering. Fournier stepped forward. He was not a tall man, but he had the particular quality of presence that comes from spending a long time in environments where the wrong decision costs lives, and it filled the corridor. "Let me tell you who you're talking to," Fournier said. His voice was entirely level, which made it more effective than if he had raised it. "Master Corporal Joanna Selig, Royal Canadian Medical Service, 6 years active duty, 2 tours in Afghanistan, 1 in Mali, attached to a joint task force operating in conditions that no civilian trauma center in this country has ever come close to approximating. In 2018, during an ambush in Kandahar province, with no surgical support and no evacuation available, she performed hemorrhage control and airway management on 4 casualties under active fire and kept all 4 of them alive until extraction. She received the Meritorious Service Medal for that action. She was cited specifically for clinical competence under extreme duress and leadership when the officer in her unit was incapacitated. He let that sit for a moment. She has more practical trauma experience than most attending physicians in this province, and you have her doing linen inventory. Dumont made a sound that was not quite a word. Gould said, "That's her military background. This is a hospital." "Yes," Fournier said, "it is. And 6 days ago, in this hospital, she saved the life of a 26-year-old Canadian soldier in 11 minutes with equipment she'd never personally selected, in a bay she hadn't set up, with a first-year resident as her only support. And the instinct she used to do it was built over 6 years of doing exactly this in conditions your staff cannot imagine." He turned to Planty, who had been standing very still for the last several minutes, with the expression of a man doing rapid mental calculations about press coverage. "Director Plante," Fournier said, "the Canadian Forces has a relationship with this hospital. Equipment procurement, training partnerships, case referrals. The continuation of that relationship is something I have some standing to speak to." He didn't raise his voice. He didn't need to. "I would suggest that relationship will be considerably warmer if the person who saved Corporal Tremblay's life is treated in a manner appropriate to her capability." Plante's mental calculations completed. Of course, he said, with the speed of a man who has just identified where the exit is. Of course, Dr. Gould, I think we should, Joanna. He turned to Selig with the warmth of a man who had never called her by her first name before and was now discovering it. We clearly owe you a conversation about your role here. You owe her considerably more than a conversation, Fournier said. But Selig was looking at Leclerc. He was still standing near the nursing station, slightly apart from the rest of the group. And he had the look of someone who had said the true thing and was now waiting to find out what it cost him. She crossed the corridor toward him. You didn't have to do that, she said quietly. Yes, I did, he said, in a tone that suggested he had been aware of this for 6 days, and it was a relief to have finally done it. She nodded, one of her economy of motion nods that people who paid attention to her had learned to read as carrying more weight than they appeared to. You're good at this work, she said. You have good instincts. They're just undertrained. If you want, I can work with you on the trauma sequencing. Leclerc looked at her for a moment. Yeah, he said. I'd like that. She turned back to the room. Gould was speaking in a low, tight voice to Plant. The conversation of two men who had just discovered that the ground under them was less solid than they'd thought. Dumont was looking at her clipboard as though it contained the answers to several questions she hadn't previously known she needed to ask. Fournier was watching Selig with the expression of someone who had driven a long way and found what they were looking for. The base hospital at Shiloh is building out its trauma training program, he said when she reached him. We've been looking for a clinical director who can develop the curriculum. Someone who understands what it looks like when things actually go wrong. A pause. The salary is better than a staff nurse position at a regional hospital. Selig looked around the ward, the monitors, the supply room, the nurses' station, where she had spent 5 years invisible. The bay where 6 days ago, a 26-year-old soldier had whispered, "Don't let me go," and she had meant it when she said she wouldn't. "I'll think about the Shiloh offer," she said, "but I'm not done here." She said it the way she said most things, without inflection, without drama, as a statement of fact. But the ward, which had been very quiet for the past several minutes, seemed to get slightly quieter. She turned to Plant. There are 3 outstanding medication error reports filed with risk management that have not been acted on. I have copies of all of them. I'd like a meeting with the medical director and the patient safety officer on Friday. A pause. Not optional. Plant nodded quickly. Doctor, Leclerc should be assigned to trauma as primary, not second call, she continued. He has the aptitude, he needs the exposure. She looked at Dumont, who straightened without meaning to, an old reflex from high school. And the linen inventory doesn't need a registered nurse. Reassign it. She didn't look at Gould. She didn't need to. Gould's case would go where all the cases went, eventually, to review boards and paper trails and the kinds of processes that moved slowly, but arrived somewhere real. She had the charts. Fournier looked at her for a long moment. There was something in his face that was grief and respect in the same measure. The way people look at things that cost a lot to preserve. He brought his hand up one more time, not a formal salute. Just a gesture, brief and honest, the kind that doesn't require a protocol. She gave him a nod that meant several things at once. You can go. I'm all right. I know what I'm doing. The soldiers filed out through the double doors, their boots quiet now on the linoleum, and the ward sounds came back in gradually. The monitors, a patient call bell down the hall, the particular hum of a building full of people who needed things. Selig picked up her clipboard. She looked at the linen inventory she'd been doing when all of this had started. She set it on the nursing station counter and picked up the charge nurse's tracking sheet instead, the one that listed every patient on the floor and their status and their next scheduled assessment. There was a lot of work to do. There always was. She started at the top of the list and began to work her way down.